Lacrimal apparatus is a complex system responsible for producing and draining tears, ensuring the health and comfort of our eyes. It consists of two main parts: the secretory portion, which includes the lacrimal glands and accessory glands, and the excretory portion, which comprises the punctum, canaliculi, lacrimal sac, and nasolacrimal duct. Tears produced by the glands contain water salts, proteins, and enzymes like lysozyme, which help protect the eye from infection. This fluid is essential for keeping the surface of the eye moist and functioning properly. Any disruption in this system can lead to various diseases and symptoms. Tears are secreted by the lacrimal glands and spread across the eyeball, keeping it moist and clean. These tears drain through tiny ducts into the nasal cavity, a process vital for eye comfort and vision. The fluid contains not only water but also immune proteins and enzymes that neutralize bacteria and viruses. In newborns, tear secretion begins a few weeks after birth. On average, adults produce about 0.5 to 2.25 ml of tears daily, maintaining a slightly alkaline pH. This delicate balance is crucial for preventing dryness and infections, highlighting the importance of a healthy lacrimal apparatus. Watering of the eye can be due to two main reasons: epiphora and lacrimation. Epiphora refers to watering caused by an obstruction in the tear drainage system, while lacrimation is due to excessive tear production by the glands. Common causes of epiphora include blockages at various points, such as the punctum, canaliculi, lacrimal sac, or nasolacrimal duct. On the other hand, reflex causes like dust, smoke, bright light, or emotional stress can trigger excessive secretion. Understanding these differences is key to diagnosing and treating the underlying issue effectively. Acryocystitis is the inflammation of the lacrimal sac, which can be either congenital or acquired. In newborns, it often results from failure of the nasolacrimal duct to open, leading to watery eyes and sometimes discharge. In adults, chronic acryocystitis is more common in middle-aged women and those from lower socioeconomic backgrounds, often due to narrowing or blockage of the duct. Symptoms include persistent watering, swelling near the nose, and sometimes mucoid or purulent discharge. Proper diagnosis and timely treatment are essential to prevent complications. In infants, congenital acryocystitis is typically managed with gentle lacrimal massage and antibiotic eye drops. The massage helps open the blocked duct by applying firm pressure over the sac area and moving downward toward the nose. If the blockage persists beyond 3 months, a surgical procedure called probing may be necessary to open the duct. Early and appropriate treatment usually resolves the condition and prevents further complications, ensuring the child's eyes remain healthy and comfortable. Chronic acryocystitis often affects adults, especially women, and is usually caused by stricture or narrowing of the nasolacrimal duct. This leads to stagnation of tears, which can become infected by bacteria like pneumococcus or staphylococci. Symptoms start with watering and progress to swelling and discharge near the inner corner of the eye. The condition can be mistaken for conjunctivitis, so careful examination is necessary. If left untreated, it can lead to complications like corneal ulcers or chronic conjunctivitis. Medical treatment fails, surgical options like dacryocystectomy (DCT) and dacryocystohinostomy (DCR) are considered. DCT involves removing the lacrimal sac, usually in elderly patients or after acute infections. DCR creates a new drainage pathway between the sac and the nasal cavity, preserving tear flow and preventing lifelong watering. Each procedure has specific indications, steps, and potential complications, such as bleeding or failed surgery. Postoperative care includes antibiotics and monitoring for infection. Acute dacryocystitis is a sudden, painful infection of the lacrimal sac, often secondary to chronic disease. It presents with severe pain, swelling, redness, and sometimes abscess formation. Immediate treatment includes hot compresses, antibiotics, and analgesics. If an abscess forms, surgical drainage is required. Once the infection is controlled, further surgery may be needed to prevent recurrence. Complications can be serious, including spread of infection to surrounding tissues or even the brain, so prompt medical attention is vital. Beyond infections, the lacrimal and conjunctival regions can be affected by conditions like theriasis palpebrarum, where crab lice infest the eyelashes, causing redness and itching. Tumors such as pigmented nevi, papillomas, and various cysts can also develop, sometimes requiring surgical removal if they cause discomfort or risk malignancy. Limbal dermatitis, benign yellow tumors, may appear at the edge of the cornea and should be excised if they irritate the eye. Early recognition and management of these disorders help maintain overall eye health.